Thank you, Chairman Scott. Thank you to Speaker Pelosi for your leadership and your relentless determination to make true the words "for the people." I'm Congressman Raul Ruiz, and I represent California's 36th Congressional District, where I practiced emergency medicine before being elected to Congress. As an emergency physician, I have seen the faces of failed healthcare policies. I have looked into the eyes of the suffering when they couldn't afford care. I have been at their bedside, resuscitating them after a severe illness took their life or their loved one's life, knowing it could have been prevented with routine care if they only had health insurance or affordable care. And even now, I have gone into hard-to-reach and high-risk communities and personally conducted COVID-19 testing, watching the health inequities and disparities play out in real time, seeing disproportionately higher rates of transmissions and deaths in low-income, uninsured, Latino farm workers, and the homeless communities. And when I'm out there, they're concerned about the affordability of care in these low-income communities and working poor communities that don't have adequate health insurance still. They're concerned of spreading it in their homes. You see, because the decisions that real working Americans right now are making are, do I get tested and maybe be positive and then I can't go to work? Well, how am I going to go to work if I'm positive? They won't let me, therefore I won't get the income to be able to support my family. These are decisions that American families should not be making in the greatest country this world has ever seen. And as a physician and humanitarian, I find it repulsive that during a global pandemic, while millions are infected by COVID-19, millions gasping for air, millions anxious and depressed because of their situation, and millions more are unemployed and struggling economically, that the Trump administration is actively trying to tear down the Affordable Care Act. What does that mean? Actively trying to eliminate protections for people with pre-existing conditions. All those underlying illnesses like cardiopulmonary diseases, diabetes, immune weaknesses that render someone more likely to die from COVID-19. Like taking away health insurance for millions of people, all those who for the first time in their lives was able to get health insurance through the Medicaid expansion. You see, repealing the ACA would be another disaster, leading to millions of families facing financial hardships and many, many, many more deaths from COVID-19. It is precisely during this time, it is precisely in our moment of history, it is precisely in the American family's agony that we must pass H.R. 1425, the Patient Protection and Affordable Care Enhancement Act, that we must act for the people and fight to make health care more affordable by stabilizing the markets, strengthening protections for pre-existing conditions, expanding even further, incentivizing other states to expand the Medicaid program, and lowering the cost of prescription drugs, as H.R. 1425, the Patient Protection and Affordable Care Enhancement Act, would do. That is why we need this bill for those patients who are concerned they have COVID, or for those families who will be infected by COVID, and for those individuals and the families who are struggling to pay their bills. And that is why Democrats will keep fighting for the people.